After a 9-hour operation, Barnard and his team of surgeons have given Louis Vashkansky, a 54-year-old former boxer, a new heart, and have got it working independently of the heart-lung machine he had been on. The next few days will be critical. Monday, the 4th of December, 1967. Day 1.
Is it really true you've managed to transplant the heart of a woman in her early 20s into the chest of an ex-boxer twice her age?
Yes, we have.
Hang on, where did you get that information? We haven't given out any information concerning the donor and the recipient.
Sorry, sir. I didn't quite catch your name, sir.
I'm Professor Schreier.
Can I just say that this operation couldn't have taken place without the inspired leadership of Professor Schreier?
But you didn't do the operation, did you, Professor?
Without Val Schreier, there wouldn't be a cardiac transplant program. He has been an inspired superior.
Professor Barnard.
And I also want to mention the dedicated work of many doctors, including my friend Dr. Kurt Venter, who will be taking much of the responsibility for the recipient's well-being in the days to come.
Hello, gentlemen.
Please, we just talk to Professor Barnard. If the donor was a small woman and the recipient was a big guy, doesn't that leave a lot of empty room in Mr. Vashkansky's chest? If you see what I mean? Huh?
Yes, it does. But how did you get his name?
The recipient's own heart was very badly diseased. At the time we excised it, his heart was the size of a shopping bag and occupied a space almost the entire width of his chest.
Can you tell us the name of the young lady who donated her heart?
No, I'm afraid not.
Why not?
This is a very difficult time for her family. The hospital doesn't feel it would be right to reveal her identity.
Come on. Excuse me, are you saying there's some kind of problem with taking this girl's heart?
No, I am saying they lost their only daughter less than 2 days ago.
Miss Denise Darvel was killed in a motor accident, wasn't she?
Darvel? How do you spell that?
No, she was not killed outright. She suffered very severe fractures of the cranium. She died in this hospital a little while after she was brought in.
Well, as you keep the heart in good condition while you prepared Mr. Vashkansky for the operation.
Yeah, why didn't the heart die?
Miss Darval spent some time on an artificial respirator after she had been declared brain dead.
Professor Barnard, how long was the operation?
9 hours.
Well, there must have been a time when Mr. Vashkansky had no heart at all before you put the new one in. Does that mean he was also dead for a while?
No. During the period that Mr. Vashkansky was without a heart, he was connected to a heart-lung machine that was oxygenating his blood and pumping it around his body. His brain was still functioning.
A lot of South Africans are very proud of what you have done, Professor Barnard. Do you have a few words for your fellow citizens?
Yeah, go on.
I am very glad if what we've done has made people feel good about their country. But you don't think about that. You operate in the hope of saving a life. How are you, Louis?
Did you give me a new heart?
Yeah, we did. We're going to move you every 2 hours, huh? So that you lie first on one side, then on the other, to help clear your lungs.
Okay.
They'll be bothering you for tests every so often. So try and sleep as much as possible, huh? Louis, I can't imagine how you must be feeling right now. But I'm going to need you to hang in there.
Home for Christmas?
I guess, yeah. Maybe.
Christmas.
I see you later, huh?
Doc.
Yeah?
You know, when I joke with the nurses about taking them dancing and such.
Yeah?
You know it's a joke. I wouldn't do anything to hurt my Anne.
Of course, Louis.
The ladies, they like a joke. But I'm not a bad person.
Tuesday, day 2, 10 o'clock. the twice-daily conference, chaired by Professor Barnard and Dr. Kurt Venter.
He's still tired, but he's feeling better. His blood pressure's dropped and his urine output has improved, which all shows his body is regaining some equilibrium. There were extraventricular beats that I thought might give us problems, but these have disappeared. Right now, I'm most concerned with anti-rejection treatment. The first massive dose of hydrocortisone, 500 milligrams, was given the day of the op. We'll stop that on the 5th post-operative day. We're going to irradiate the heart to destroy the lymphocytes that will now be invading it.
Lymphocytes, blood cells that attack and kill infection.
I expect his condition will become clearer as we diminish the hydrocortisone, and we can see what success we've had with blocking the rejection mechanism. I am a bit concerned that the level of urea in his blood has risen.
The kidneys aren't working properly.
And the level of enzymes
The most potent weapon the body has against invasion.
has risen as well.
Does the enzyme level indicate infection?
It's too early to say.
Infection is nearly as much a threat as rejection. And both will announce themselves in similar ways. We have to be very careful we don't treat the wrong thing. If we do, we'll kill him. With no conclusive evidence of infection or rejection, I suggest we continue with the treatment as planned.
Later that day, Dr. LaRue, the hospital X-ray specialist, constructs a mobile device to irradiate the heart. Its low power means Vashkansky has to remain still for 2 hours. This is agony for him. Then the drains are removed from his abdomen and he's allowed to eat some soup and a soft-boiled egg.
Hello.
Chris?
Good. What's the matter?
Vashansky's heart rate is holding steady at 85 beats per minute, but we have a flutter in the atria.
Look, call me again if there's any more deterioration. Huh?
Sure. It feels like we've got it under control. Don't you think?
I don't know. Too soon to tell. Any more problems with the press?
Security caught a reporter dressed as an orderly.
And you're okay on the night shift, huh?
Yeah, no problem.
Wednesday, day 3, 8 a.m. Vashkansky's heart rhythm is still causing concern.
Good morning, Louis. You remember my boss, Professor Schreier?
Oh, sure. Hello, Doc.
Hello, Louis. You look great. Can I just listen to that heart of yours?
So is it mine or is it still hers?
It's yours now.
He says he's the new Frankenstein.
That's me. I'm going to scare people off the streets.
Ah, you know Frankenstein. You're an angel.
Right. That's good, Louis. Can I just feel around your kidneys? Yeah, I'm done. Not bad, Louis, not bad at all.
I'll be back shortly, Louis.
I'll be right here, Doc. Oh, Doc, how soon before I can see my wife?
You've got to give us a few days, huh? Remember, we have to watch out for infection.
Okay, Doc.
Yeah, no, sure, there's an atrial flutter, but it's not important, Chris. I think you've done marvellously, mate. He's clinically well, so stop worrying.
Will you stay to talk things over with Kurt Venter?
Look, I've got patients waiting.
Please come, Val. We need good advice right now. We're meeting at 10.
Okay. See you later. Morning, Chris.
At the 10 o'clock meeting, Barnard reports that the patient is improving all the time.
No, I think you're right. His heart's in good condition. The systolic murmur has disappeared. There's no enlargement of the liver that I can feel, and no gallop rhythm.
I had a visit early this morning from Dr. Pimston.
Yeah?
He's been treating Mr. Vashansky's diabetes, and of course, that has meant controlling his calorie intake. Now, Pimston is saying we mustn't ignore the fact that Vashansky's body has to rebuild itself.
Yeah, we know that.
Basically, we can't keep on starving him, you know. He needs proteins, and we ought to be cramming food into him.
Well, then we'll do just that.
Yeah.
What about blood and urine?
Vashansky's blood urea is still going up. That said, there is evidence his kidneys are getting more efficient, and he may be heading for a time when they can deal with toxins efficiently. But Dr. Pachita says he's concerned that Washansky's enzyme level is still rising.
Or does he think the patient has an infection?
I asked him that. He hopes it might be a result of irradiating the heart, or the after effects of surgical tissue damage, which would tie in with the blood toxins.
Yeah, but that's...
Or else it might be the beginning of the destruction of the heart by rejection, which of course raises the question of more radical immunosuppression.
See, I just don't see the benefit in listening to specialists who won't take an overview. You don't need all those reports.
We're in uncharted seas, Val. I have to try to spot the rejection or infection before they take hold.
Yeah, and how can you do that by looking at enzymes?
Because they're an indication of kidney failure, which could be associated with rejection.
Rubbish. The function of the kidney is to put out urine. In the last 24 hours, Washkansky's given out 1/3 more urine than liquid he's taken in. That's good. You don't have to scrabble for clues. You can measure urine in quart jars. Don't rush to administer drug treatments that might mask developing problems. You have to hold your fire until we see the whites of the enemy's eyes. You didn't transplant a kidney. Watch his heart, Chris. His heart.
7 a.m. Thursday the 7th of December. Day 4.
His pulse rate has increased to 150 with persistent atrial flutter.
Well, how does he look?
Fine. He slept well. His urine output is satisfactory. There's no temperature. And he's had a good breakfast. Are you still happy about us taking him to X-ray?
It was pathetic making him stay still so we could do yesterday's bedside X-ray. It was torture. Yeah, he has to go to the X-ray department, but for heaven's sake, don't let him catch anything, huh?
Well, we've got him under a tent with an isolated oxygen supply, and it's still early enough that there are very few people about.
Well, you keep him well covered. Has the elevator been washed?
Yeah.
You stay with him every minute. We'll get you out as soon as we can.
Oh, that'd be a real Christmas present. It's less than 2 weeks to Christmas, you know.
We'll try and make it.
I'll be home for Christmas. Do you remember that one?
Yes.
Good old Bing Crosby, eh?
His pulse is down to 144, Val.
Uh-huh.
Yeah, it's a drop.
Yeah.
Small, but it's encouraging.
Yeah. How are today's reports?
We don't seem to be finding concrete evidence of rejection, and there is improvement elsewhere.
Ah, good.
The only disturbing factor is his heart rate.
Yeah, well, we need to deal with that.
Right.
Slow it down.
What with?
Digoxin.
Shumway and Lauer found that drug could be dangerous.
Shumway and Lauer were talking about dogs. This is a human being. I think you should proceed with digoxin straight away.
Are you worried?
Concerned, but no, not worried. Let me know how things are by lunchtime, okay?
We've agreed that Washkansky can do a 30-second interview with the South African Broadcasting Corporation.
You're joking.
No, I've been told it's important for the hospital. Kurt Venter will hold a sterilized microphone. He'll ask Washkansky a few questions, after which Anne Washkansky will be allowed to see her husband for the first time since the operation.
Louis, it's me.
Hello, kid.
I'm afraid to come closer. I might infect you.
You could hold my hand here. Just no kissing, that's all. Don't look so worried.
Now, I know you'll pull through. It's wonderful. Louis, you're world famous. Your name is even on the Sandland building.
Are you serious?
Yes, your name is running around the top of the Sandland building. And it's in all the papers. Everybody's talking about you.
You mean it?
Everybody is listening to every word you say. You're a very famous person.
Oh, I'm not famous. The doctor, he's famous. What have I done? Nothing.
Well, you've been very brave. Not many people could put up with this and the years of pain that went before it. Oh, Louis.
Oh, Annie, please. You know, sometimes I took a fight because we needed the money. And I thought I might stand a chance. It's just like those days. I'm lying here because I took a chance in our favor. I got a little beat up, that's all.
He always used to say, stick around me, kid. I'll make you famous. Oh, Louis, I'm so happy I could cry.
Now, don't do that. No.
Friday, day 5.
Yeah.
Chris, his pulse rate is back up.
Have you given more digoxin?
Yes, at 1 a.m. and then again at 2. But it had no effect. He doesn't have a temperature, but he's very sluggish.
How's it going, Louis?
Oh, I've had enough. Leave me alone. I can't sleep, I can't eat, I can't do anything. You said you can't guess what this feels like. Well, I can tell you, Doc. I can't remember when I wasn't in pain. I can't remember what it is to look forward to the next day. They're at me all the time with their needles and their tubes, day and night. It's driving me crazy.
All right, Louis. Be patient, huh? We'll see what we can do. How's his cardiograph readout?
There's an obvious drop in heart voltage and his heart rate has risen to 150. I think it's pretty clear we're heading for trouble.
Well, he obviously isn't well. But I don't know if it's a rejection or the effect of our constant persecution. What do you think?
As far as I'm concerned, a drop in voltage looks like rejection. Shunwei and Lauer have a paper on precisely this, and we've seen it ourselves with the dogs.
He's never been as depressed as this before.
No, the poor man's never allowed more than 2 hours sleep at a time. I guess that would get anyone down.
I think we should give him a rest. See if it makes any difference. Give him enough pethidine to put him out. I don't want him disturbed. I'm not going to invite speculation until we've seen the effect of a proper rest.
At 1:30 p.m, Louis Vashkansky awakes refreshed. It doesn't last.
Sorry to disturb your lunch, pal.
No. What happened?
His heart rate's risen to 150.
Oh, damn. Well, I'm sorry, Chris, man. I have to admit we're probably seeing rejection.
Well, this is it, then. We're going to have to hit the graft site with a barrage of immunosuppressive drugs.
Yeah, okay. It's a shame. I was hoping we could avoid this. Keep in mind that by destroying his resistance, we'll be leaving him open to bacterial attack. I read Forder's report, by the way. He's found a very dangerous organism called Klebsiella. It's in Washkansky's left nostril, in his mouth and his rectum. I suggest gentamicin. It'll work on the Klebsiella, and it's the broadest spectrum antibiotic we've got. It'll protect us from trouble while you're dosing him against rejection.
Okay.
Success. The anti-rejection treatment works. From Saturday, Vashkansky experiences a glorious new life.
Hey, Louis. How are you feeling?
Better and hungrier. I get so hungry that I have pains in my stomach like now. If they give me some milk or soup, it goes away.
I've been meaning to ask you what it felt like when you woke up.
I woke up and it was all different. And I wondered why. Then I realized that I was breathing properly. Doc, you know what my breathing was like? Well, I could breathe again because my heart had been fixed up.
You just said my heart. That's good. That means you trust it. It's your own heart now.
I guess so.
So today we'll remove the oxygen tent and take out that last drip line. I'm going to get you a radio. You can turn on the news and hear all about yourself.
Doc, I never felt better in my life. Or happier.
Happier. That's good.
This morning my wonderful wife said you've given her back the man that she thought she'd lost.
She's a wonderful woman.
And that's exactly what she is. Oh, and she told me that our rabbi wants to see me tomorrow. Why should I have a rabbi?
Louis, you're a famous man now. I mean, probably the rabbi wants to come and shake your hand.
So the mountain comes to Muhammad?
On the 11th day, Professor Barnard wakes and calls Dr. Kurt Venter.
He woke 3 times during the night with strong abdominal pains.
Yeah?
At 11:30 he had an omelette, but the pain was back by 2:30, so we gave him a slice of toast and a glass of milk. Then he wanted milk again at 4:30.
Does eating always take the pain away?
Yeah. Well, do you think he's got an ulcer?
I wouldn't have thought so. Given the amount of alkali we've put into him. How's he feeling now?
He woke properly at 6. He was tired and irritable at first. Then after breakfast he seemed much better. He's sitting up in bed, shaving himself for the first time. It's a big day. The mayor and the rabbi are coming.
I've got Mibisham's blood report here.
Good.
There are toxic changes in the white cells, probably due to immunosuppression, which could also come from an infection.
What do you think?
If the stomach pains are linked to an infection, I guess it could be his pancreas. Actually, the pain seems to be getting better. He's irritable, though. And today, when his family came to see him, he cried. I haven't seen him do that before. Maybe he knows there's something wrong, and he's not saying.
What indications do you have?
Nothing, just a hunch. His chest X-ray is clear. Stools and urine show no sign of infection. His heart voltage has come up again.
So no real evidence of infection anywhere, then?
Not as far as we can tell.
On the morning of day 12, Vashkansky complains of a new pain in his left shoulder. Today he's due to meet a government cabinet minister, be photographed by Stern magazine, appear on CBS and be interviewed by the BBC. After all these visits, Vashkansky's wife comes in. He is very tired. She spots something wrong straight away.
He's got a cold.
No one takes much notice of Anne Vashkansky's remark, and Professor Barnard is distracted by the arrival of a new transplant candidate, Philip Bleiberg.
Good.
I need to talk to you before you leave.
What is it?
Vashansky's latest X-ray shows a shadow on his left lung.
Let me see.
It's very tiny. I thought you should look at it.
What do you see?
I don't know. He's running a slight temperature, 98.6. Also, he's finally admitted he isn't feeling well.
Let's get a new X-ray first thing tomorrow morning.
Okay.
Saturday, the 16th of December, day 13.
What's wrong, Louis?
Oh, I'm worn out. And there's a pain here in my chest, and also here. Oh, this is my shoulder and my neck.
You might have caught a slight cold. Is he coughing, Kurt?
Yes, a little.
Any sputum?
Nothing yet.
All right. We'll have to keep you quiet for a while, Louis. No more television shows.
Oh, thank God, Doc.
The small shadow on yesterday's X-ray has grown 100 times. It is spreading from the left lung to the right with remarkable speed.
It could be pneumonia. Or a blood clot which is broken away from the stitching line in the right atrium of the heart. A clot could have travelled into the lungs where it's caused an infarction.
The death of an area of the lung due to obstructed circulation.
I suppose there could even be multiple clots, causing several patches of dying tissue.
An infarct needs treatment with heparin to prevent further clotting. Pneumonia requires an antibiotic specific to whatever's causing it. We can't find out for certain what's wrong until we get some sputum to study.
And he isn't producing any.
Yeah, the X-ray looks like an infection more than an infarct. I can't tell what's causing it. If he has an infarct and we treat him for pneumonia, we may lose him. It's a gamble. Reluctantly, I think I have to say we'll treat him for an infarct, pending an example of sputum or any other evidence proving this to be pneumonia. Let's put in 25,000 units of heparin over 24 hours, huh?
No, he has pneumonia, Chris.
How do you know?
Coughed some sputum around 1 p.m. It's rusty and looks pneumonic. What else do you think he has?
We discussed pulmonary infarct this morning.
What's your evidence?
Clots could be breaking loose from the sutures in the heart.
No, this is old-fashioned rusty pneumonia. Penicillin will wipe it out with no trouble.
Maybe you're right.
I know I'm right. Christiane, it's straightforward pneumonia. Keep the heparin going if you like, but you should certainly put penicillin into him right away. We caught it in time. Okay?
Professor Barnard calls in on Vashkansky before going home. The patient is sedated and coughs unpleasantly in his sleep. He is breathing heavily and his temperature is up, 103.8. Later on, in the early hours of day 14, Sunday the 17th of December, Barnard is woken by a call from a journalist. They've heard about Vashkansky's illness. Barnard puts them off, then phones Kurt Venter.
Not good. He's wet himself twice in bed.
Oh, no.
He's breathing faster, and the antibiotics haven't brought his temperature down. He refuses to eat or drink. He won't do anything. Won't cooperate.
How's the heart?
Oh, he's all right. The pulse is up to 106, and his blood pressure is 115, but I think that can be expected with what we have.
But the penicillin should be having more effect. Maybe we were right about the infarct and we should be doing more. Is he still coughing?
A little less, maybe.
All right. Look, put a pulse tube on him to take care of the bedwetting. I'll be in early to see how he's getting on. Louis, your breakfast is getting cold. Sister Pop and Dirk promised to dance with you when you're up and well. She's a cracker, Louis. You did well to pull that off.
No, Doctor. I can't eat. It hurts when I breathe.
Louis, you have to eat.
We've tested more sputum. I think it's safe to say we've just about obliterated the cause of the pneumonia. It still isn't getting better.
So should we concentrate on the effects of clotting?
I'm not sure. I can't help thinking he has an infection that we're managing to cure.
But the sputum isn't telling us what it is.
Excuse me. I don't know what to say, other than to continue the same therapy for a while longer.
2 hours later.
The new X-ray shows even denser lung lesions and new ones forming. Can I have another potato, please? What's happening?
There are very few pus cells. I'd say we have this pneumonia well under control. I think we're back to the issue of infarcts, blood clots. What we're seeing could be emboli caused by multiple clots breaking away from the heart.
I don't know. Let's continue with heparin and penicillin and see where we are in the morning. Maybe you'll rally overnight.
Day 15, Monday the 18th of December. Struggling for air, Vashkansky finally refuses to take food, forcing the doctors to put a gastric tube in through his nose. It is now terribly difficult for him to speak. This feels like a defeat for everyone, most of all for Louis Vashkansky.
He's got diarrhea and he can't control his bowels.
Oh, God.
Early this evening he started passing feces in bed. The pain in his chest has spread to his arms and legs, and so now he refuses to be moved. He'd rather lie in his own dirt.
Hello, Louis. How goes it?
I'll never get home by Christmas.
You might, Louis. There's a chance.
No, not now. I've got the tubes in my arms again. It's a wipeout. I'm losing every round.
Come on, you're strong. And you're alive. That means we're still ahead. We can still make it.
You think so?
Yes, I'm sure of it.
Then I'll believe you.
Louis Vashkansky is gasping for air. X-rays show the mottled areas on his lungs joining up. The team is joined by the pathologist in charge of tissue typing, MC Botha. Everyone in the transplant team is there, except Val Schreier.
Okay. So, thanks for coming, MC.
Right. How's the patient?
More diarrhea. His legs are now showing a mottled appearance, indicating his circulation is failing. His feet are cold, and his breathing is getting heavier.
What do you think, Chris?
I've been trying to work it out. I've come to the conclusion the only thing that makes sense is that we're facing some unknown immunological complication. I think we should forget about the clots and treat the patient for rejection.
But, Chris, today's specimen of sputum shows a downturn, numerous new pus cells. This has to be a lung infection. We just can't identify the bacteria, that's all.
There was talk of Klebsiella a while ago. Have you found it in the sputum samples?
No.
But I've reviewed the case, and for me it's clear. We have to go with treating the patient for rejection. What we're seeing here compares very well with Hume's study of post-transplant complications in dogs. It seems to fit absolutely with his examples of rejection, what he calls transplant lung. And I'll certainly back you on it.
I can't argue with that. So as long as you're convinced, Chris.
Okay. Then we go in hard and treat him for rejection.
Are you sure?
I'm sure we're doing the right thing.
And I'm convinced it'll only be a matter of time before you see a big improvement.
I'm not certain, but I think Washansky is responding positively.
That's good.
We put him back in an oxygen tent and he's sleeping and breathing more comfortably. He asked for you.
Tuesday, the 19th of December, day 16. Vashkansky turns blue and has to be put back on the artificial respirator. He cannot talk anymore.
Yes?
Professor Barnard, it's Anne Boshkansky.
Anne! How are you?
The newspapers keep calling. They say that Louis is dying.
They're lying to you, Mrs. Washkansky.
Oh, thank God.
Don't listen to them. Don't answer the phone.
How is he today? Better?
He's holding his own, Mrs. Washkansky. We think we've isolated the trouble and there will be some improvement.
Oh, thank God. God bless you, Professor.
Wednesday, the 20th of December, day 17. Vashkansky seems to be holding steady. Thursday, the 21st of December, day 18.
The lab just called me.
Yeah?
They've grown Klebsiella from yesterday's sputum samples.
So that was it.
I spoke to Forder. They got heavy growths of Klebsiella and Pseudomonas from the latest sputum specimen.
But Forder's report said they only found a trace.
Washansky had ordinary pneumonia and a trace of Klebsiella. Both were treated very effectively. The antibiotics did the job.
Then I don't understand.
Well, Forder reckons the Klebsiella retreated to the oral cavity. Then, after we killed off the common pneumonia, it advanced back in and took over.
So I was wrong. It isn't rejection. And clotting was never an issue.
That's right.
We have to press on. If we can keep him live long enough to treat the Klebsiella effectively with antibiotics, then we can save him. That's for certain.
They managed to stabilize his blood pressure with transfusions and adrenaline. They stimulate his heart with isoprenaline. But Louis's remaining areas of functioning lung are seized by the infection. Professor Barnard is desperate to get oxygen into the patient's bloodstream and calls Osinski, the anaesthetist who kept Vashkansky alive through the 9-hour transplant operation.
I can only get the respirator to deliver 40% oxygen. So we need to get more into him, right?
Yeah.
Okay. I'm going to connect his endotracheal tube to an anesthetic machine so I can ventilate the lungs manually. That will allow us to deliver up to 100% oxygen.
Great, Ozzy.
Dr. Osinski stands by the bed, pumping the bag 23 times each minute. He is confident he can hold this last line of defence, forcing oxygen into the remaining area of Vashkansky's lungs.
I'm only giving 70% oxygen, so we still have a margin to play around with.
As midnight approaches, it is necessary to fall back on their reserve, pumping 80% pure oxygen, then 90%, and finally 100%. They have reached the limit. With all reserves deployed, they have to hold on to what remains, or lose the battle. This is Vashkansky's last chance.
No, Louis, I envy you the way you flirt with those nurses. I tried it on with Sister Leeming one time and she just laughed at me. Yeah, I met a guy last week, said he'd seen you fight. Said he remembered you because of the way you took a punch. I guess that's something else I don't have. That kind of pluck. That family of yours. You'll be out with them next summer, picnicking and laughing about how old Ozzy can yak. Chris.
Yeah?
I think that's it. He's slipping away.
Got to get him more time, so the antibiotics can do their job. We can use the heart-lung machine.
What?
We can put him back on the oxygenator. It'll clean the blood and give us the time we need to fight the infection.
But we've never had a man on bypass for more than 5 hours.
Even 5 hours is more than we need.
How will you do it?
Through the thorax. We don't have to open the sternum or touch the heart.
Chris, are you sure it's worth it?
No, I'm not sure of anything. Except that we have to do something.
Professor Barnard leaves the room to phone Val Schreier. It is almost 3 a.m.
Val?
Yeah.
We can't ventilate Vashkansky any further, and I'm considering putting him back on the heart-lung machine.
What?
It'll give us time. We're treating the real thing now, and if we can just give him a little more time, then...
It's over, man. Washkansky's lost. Everybody knows it except you. It would be inhuman to put him back on the pump. Chris, are you there?
So, you think there's nothing left?
I'm sorry.
Oh, it's too much to bear. That heart, it keeps on going. It's a perfect heart. There's nothing wrong with it.
Louis, it's me. I've come to be with you. I forgot my gloves and my mask, but that's okay. I can touch your hand, eh? Maybe even give you a little kiss. I'm sorry you've been so lonely in here with no one touching you. It's been a wonderful life.
By 4:30 a.m. we had to ask Anne and her family to leave the room. His stomach had begun to distend and we had to suction off some fluid. Shortly after 5 a.m. the circulation fell off and he turned dark blue, almost black. Despite this, the heart kept on in regular rhythm. Finally broke its pattern at 6:30. The child was going under. The bird was floundering. I walked out here to see the sun come up.
How's the post-mortem?
His lungs were filled with blue-green pneumonia. No airspace. Val Schreier was right. The heart-lung machine would have been useless.
Professor Thompson says the heart looked wonderful. The suture lines were perfect. You did a good job, Chris. You know, it wasn't a failure. It was the first attempt. And it took place so there could be a second.
It's hard to think about doing it again.
Right now, I guess your next patient isn't thinking about much else. Maybe you should comb your hair and go and see him. He's dying, Chris. He needs you.
I'll wait outside.
No, don't go, Mrs. Blayberg. I want to talk to both of you. Dr. Blayberg, do you know that Mr. Waszkanski died this morning?
No. I didn't know it.
I didn't tell him. I didn't know how to.
I expected it. I've been listening to the radio. I know how ill he was.
He died of pneumonia. And there was no evidence, as far as we could see, of a failure of the transplanted heart. But the transplant was a failure, because we didn't succeed in keeping him alive. If you don't want to go through with the operation, you don't have to. It's for you to decide.
Professor, I want to be a well man. If I can't get well, then I'd rather be dead. How soon will you be ready to do the next transplant?
I have to go abroad for about 10 days. But we'll do it as soon as possible after I come back. In the meantime, I'll transfer you to my ward. Hey, promise me you'll stay alive until I get back.
Don't worry, Doctor. I'll be right here, waiting.
The second operation took place, and Blayberg lived for 18 months until his body rejected the new heart. By that time, Christian Barnard had become a media sensation, and the techniques of heart transplantation forge ahead throughout the developed world, until the whole program is brought to a halt when every single recipient dies. As Barnard's profile soars, his private life falls apart. He leaves his family, remarries twice, and his reputation in medicine falters amid a flurry of jet-set nonsense as he dates actresses and pens lurid popular thrillers. In the 70s, the transplant program is revived and it becomes a standard medical procedure. At age 78, Professor Christian Barnard succumbs to a fatal asthma attack beside a swimming pool in Cyprus. The cause of death is temporarily misdiagnosed as heart failure.